Hi, everyone. It's Kelly from the Hub. I am here today with Angela. She works at CAP in the domestic violence program. So, Angela, how are you?
I'm great this morning. How are you, Kelly?
I'm doing really well. So, some of you are thinking to yourself, I wonder what this is going to be about. So, we know that there are some concerns in the community about, what do you do? What do you know? What is this whole stuff? How do I access services? What if I have a friend? So we are starting a series, and so you're gonna be hanging out with Angela quite a lot. We're starting a series so that Angela can teach us, and you guys can ask questions through me if you'd like, and we can help get all this stuff rolling. So, Angela, CAP runs. Oh, sorry, CAP. CAP is the Community Action Partnership. They are headquartered in Lancaster, but we have a branch office of CAP that's in the Community Commons, of course, where we do WIC and we do utility assistance. So what's the domestic violence program? Like, what's it about? What do you do? How does this whole thing work?
Great. Yeah, sure. So Domestic Violence Services of Lancaster County has actually been a program of CAP, the Community Action Partnership, for 44 years. Domestic violence, yeah, really. A lot of people are surprised to know that
Yeah,
even
like,
today.
that's right. Like, that's not like it started in 2001. Like,
Right.
this has been going on for a bit, right? This is
Right.
not new stuff, right?
So we are, DVS is what we call ourselves. We are the designated quote unquote DV program, domestic violence program for Lancaster County. We are a member program of the Pennsylvania Coalition Against Domestic Violence. So that is the statewide coalition that oversees all of the domestic violence programs across the state of Pennsylvania. They provide funding to us. They have standards for how our services should be provided. They provide technical assistance. They audit us every several years. So they're really making sure that the network of programs across Pennsylvania are operating in similar fashions, providing similar services in similar ways, right? Things are going to be a little different here than they might be in Butler County or Crawford County, or if you go up to that northern fringe where, it gets even more rural than
Yeah.
Denver and Ephrata.
Yeah, and you know what? I feel but you know how like there's counties that were on the list, like Venango County, and I'm not saying
Yeah.
anything. I didn't know that was the name of a county, which I
Yeah.
felt, I mean, I'm not trying to, but I was like, oh, I don't know. 6 or 8 people could probably live there. I'm
Right.
not choosing them. It's terrible. But you're
Right.
right. The way that the shape, like the specific shape of the program takes on what the county needs and what the county desires. So in Lancaster,
Exactly.
there's probably going to be, you know, people who, you're dealing with the plain population more than you would in other counties. And it's different because we've got, like one urban center or 1.5 urban centers. I count effort as
Right.
the half. And, and then there's a lot of really rural sections out there. So you're right. Even though it's real similar across the state, those little differences are very helpful.
Right. So every program in every county is going to have a hotline, a 24-hour hotline. They're going to provide safe house, or what some people commonly refer to as shelter services. There's probably going to be a counseling component, and maybe a community education or prevention education component. So there are some services that are pretty standard, but again, it's really based on the county and how the county operates. So we are part of that network. And I tell people that because you may not live in Lancaster County all your life. You may have friends or relatives in another place in the state, and if they need these services, it's important to know that they're there. Wherever you are in Pennsylvania, each county has a designated domestic violence program where they can go for confidential services that are provided at no cost to the client. So we're part of CAP, we're part of this broader network of domestic violence programs. And like I said, all of our services are confidential. which means that we can't confirm or deny anything. Like it's pretty much right below that attorney privilege that people have.
Yep.
We can't let anybody know who our clients are without the written permission of the client. And also all of our services, including our educational programs, our training programs, are provided at no cost to our community here in Lancaster County. So our mission is to domestic violence services as a catalyst to end domestic violence in Lancaster County through direct service, advocacy, and social change. So I thought today, to get things started with our series, it would be good to let people know the services that we're providing.
Excellent. Good. Thank you.
So the way that people would mostly get connected to us is through our 24-hour hotline. And we are operating 24 hours a day, 7 days a week. And we have been. We did not shut down for 1 minute during COVID.
Wow.
We kept the hotline and our text line going. We even kept our safe house services going, and I'll tell you a little bit more about that. But the hotline is essentially that 24-hour hotline crisis line. People call because they're looking for safe shelter. They're looking for counseling services. I have taken several calls from mothers whose adult daughters are in abusive relationships, and they don't know what to do, and they want to help her, but they don't know what to do. So our services are not just for victims who are actively in a relationship, but also survivors. Maybe somebody who experienced something in their past. They're out of that relationship now, but there's this long-term lingering impact. We provide services to those folks, and we provide services to significant others. So those moms, friends, family members. I did a training yesterday with some medical personnel. They would be able to call the hotline and say, I'm working with this patient. I think this might be going on. Do you have any tips or suggestions that I can give them? So we are going to work with anybody who calls the hotline and asks for more information or asks for help.
I got to say, knowing that your hotline doesn't go down is a huge deal for people who need to reach out. So there are lots of, when you're in that moment of crisis, you need to know that you can count on that service. So that's really good to know. And to know that it's not just for that person who's experiencing that issue at that moment.
We know that domestic violence impacts entire family systems. So if you think about dropping a stone in the pond, that first ripple might be the person who's most directly impacted, the direct victim. But those ripples, there's children sometimes, there's other family members, there's friends, there's coworkers, employers, church communities, other people are picking up. I think at least intuitively, a lot of times people might think, something doesn't seem quite right, but I can't put my finger on it, right? I've heard that, and then I've heard I never would have guessed. They were such a great couple, or he was so nice, or, whatever. And we'll talk about that in another conversation. But, it really is important to recognize that there's an impact, and there's an impact on our community. And that's part of our mission, right? Like, that's why we want to engage the community as well, to bring the community awareness level up. And for us to recognize that if we continue to be silent about it, and if we continue to lack the resources that victims need to get out of the situations that they're in to be more self-sufficient, but that's on us too, as a community, for not supporting that victim.
Right.
So we look at this from lots of different layers and levels.
Good.
So another way that somebody might reach out to us is through our text line. We've been working on a text line since October of last year, and we finally got it up and running during COVID, right?
Awesome.
Because that was one of the things we were hearing, was with people being in lockdown and being locked up with their abusers for so much time, that it may have been more difficult for some people to actually make a phone call. So sometimes having a text conversation is a little easier when you're trying to do things on the down low.
Right.
So we have a text line now. People can text the word SAFE, SAFE, to the number 61222. And the person who's answering the hotline is also answering the text line. So they're there to be able to have those conversations and help triage that situation and then get them connected to further support and services. So even during COVID, hotline was running, text line was running, and the courts were still operating for protection from abuse orders. I don't know if that's widely known, but the court never shut down when it came to PFAs. And we had an advocate in court at the courthouse 3 days a week, helping people to navigate that process. So
that's good to know. That's good to know.
So if we, and I'm saying some of these things because if we have to go back to another lockdown or modified lockdown.
Right, if we're yellow or red again, right, who knows, right.
Right. So one of the other things that people, I do, I work in the community all the time. I'm talking to people all the time about our services. Most people know that we have a safe house.
Yeah. Some
people might would have commonly referred to that as a shelter, and we did for lots of years. But when I say the word shelter to you, what's the visual in your mind?
Right. The first thing you think of shelter is always homeless.
Right.
And this is not about necessarily being homeless. This is about a safe place that you can go and then get your resources and all that other stuff. So I like the word safe house better than shelter as well. Yeah.
Yeah. So we've been, language is really powerful.
Yeah.
And I'm looking forward to some future sessions to talk about that because I've got some other spins too.
Yep.
But safe house is really important because we're a house with 13.
Uh-oh, you froze for a second.
Bedrooms. Each family gets.
So you froze for a second. You said you have a safe house with 13 bedrooms.
Okay.
And then we didn't hear the rest.
So we have a 13 bedrooms, bathrooms throughout the house as well. We have like a living room with a TV and everything that they can share.
Wow.
We have a dining room that folks share. We have a small computer room, full-size kitchen. So we do have these communal spaces that folks can share as well. We try and make it feel like a house. With that said, and with COVID and some of the restrictions that we have in place about capacity, we are not able to fill the house with 13 people or 13 families at this point in time. So one of the other transitions that we have made is that we have our working with us to provide hotel space, hotel rooms for the families who we can't bring in to the safe house. So we are still at our capacity of, 13 families or whatever that might look like. They're just not all in the safe house right now. They're in some other locations in the community. And so that also changes our services a little bit more. We're more mobile, right? So we're still providing case management services to those folks. When folks come in, it's really important to establish some goals and to figure out what their next steps are going to be, because this is not a long-term solution. Right. Our safe house services are about 60 days, give or take. And so that can be really challenging if you think about, even if you had to move and you have less barriers presumably than, someone who's fleeing a dangerous relationship. It's going to take a minute to catch your breath and then to figure out what comes next and to do all of that.
Right.
So even 60 days is kind of a push, but we do make decisions about about extending that based on individual cases. And, if somebody's got something in the pipeline, we don't want to mess with that. Like we want to support people through to the end as best as we can. So with our Safe House services, every family has a case manager or an advocate assigned to them, and they're working on those goal plans. We have individual counseling available to them. We use an empowerment-focused model and a trauma-informed model. So we're not therapists. We don't, we're not diagnosing anybody with any kind of mental health disorders, but we are working with them to help them identify how this violence in their life, this trauma that they've experienced, how it's impacted them and maybe their children if they have children with them, and how do they move forward from that. So the counseling that we provide is really focused on individual goals, and how they, exploring some of those impacts and how they want their life to be different.
Yeah.
We also talk about trauma. I don't know if any of your other guests have been talking about trauma or trauma-informed care.
We've been doing a lot of trauma work at the Hub. Our partners know we talk about that when we talk with clients as well.
Great.
Yeah.
There is there's a movement in Lancaster to make Lancaster County a trauma-informed community.
Yep.
And Governor Wolf has committed to making Pennsylvania a trauma-informed state. That happened last summer. So I feel good that that we're moving in those directions. We in the domestic violence world have been talking about trauma for quite some time. Yeah. Obviously, this is the work that we do. These are the people who we serve. So we really lean into that with folks and help people to understand what trauma feels like in their bodies, how it presents itself, how it can get in the way sometimes, and to have some of those self-regulation techniques and tools to be able to counterbalance those moments when they have them. So that's some of the work that we do. We also do that work with children. So many times, we have families who come into the Safe House. And so under normal circumstances, without COVID, we would be running adult groups for the adults in the house 4 nights a week, Monday through Thursday. And there's a variety of topics, like there's a self-care series, there's a domestic violence education series, so different series that we run. And while the parents are in the groups, we have children's activities. We have a full children's wing, and we have a curriculum for the children that's trauma-informed, evidence-based practices. We really want the children to also understand the trauma that they've experienced and what it feels like in their bodies and how they can take control of that moving forward. We know that the schools are doing more of that too, right?
Absolutely.
When they have those timeout corners, or even some of the everyday practices that they're doing, the feelings check-ins and things like that, that's all connected to trauma and self-regulation. And right. So we continue those practices here. And it's really important for kids to get that consistent message across the board.
Yeah.
So we have staff, interns, and volunteers who do that work. All of our work is conducted by staff, interns, and volunteers. All of us have been trained. The initial training is 45 hours, and then there's 10 hours every year that we have to have as part of our continuing education. So we take it seriously. This is important work that we're doing. And so we do take that.
You are helping to change people's lives.
Right.
I mean, people's lives are like changing in front of you, and you're there to walk alongside them and help them through probably one of the most painful times they've ever had.
Exactly.
Yeah.
That's exactly right.
Yeah.
So within the Safe House, within our residential component, those are the things that are happening within the Safe House. But that's only one part of our program, our larger program. We have a transitional housing program. So at another part of town, we have an apartment building with 10 apartments. And those are for longer term stays. So sometimes people are transitioning out of the Safe House and there's space there. They're working on longer term goals. They could be doing credit repair. They could be furthering their education in some way. We had somebody who just moved out this summer during COVID into her own home. She bought a home, and she was able to save up and go through that whole process while she was over at the Bridge House. So these are folks who are really, committed to that long-term process and see themselves as residents in the community and wanting to put those roots down. So we do that work over there. There's also a children's component at the Bridge House because those are families, right, who are living in the apartments there as well. We have 1 and 2 bedroom apartments over there at the Bridge House. So that's our residential component. And then we also have non-residential services. So services for somebody living in the community. I mentioned individual counseling. It took us a minute to find our footing for that during COVID, because typically counseling is done in person.
Right.
Right? That's how we've always conducted ourselves.
Right. And because it feels intimate that way, because you are telling some of the most intimate things that have happened in your life. Right.
Right. And that's why places like the Northern Hub can be really convenient, because it's a place for us to meet with people.
Yep.
Where they are or closer to their home. But what we found during COVID is that we've been able to set up some telehealth platforms and conduct counseling either, through something like this, through telephone calls. And we actually saw a huge increase for counseling requests during COVID.
Yeah.
Like more numbers than we've ever seen before.
Yeah.
So that was kind of surprising for us. At one point in time, like right after we shut down, the request for Safe House went down. The hotline wasn't really busy, but I would say by mid-April, things were starting to come back up. And I think right now we're where we usually are. So the individual counseling continues to happen, and we're working on the support groups and how we can get those support groups up and running again. But those services are provided for people who are living in the community. So you don't have to be somebody who's living in the Safe House to be eligible for our services. Anybody from the community can do that. And then finally, we have our legal clinic. It's a civil legal clinic. And so we have attorneys and advocates there who are representing clients who are experiencing civil legal matters. Protection from abuse orders is probably the #1 issue that we see there. But we also work with clients who are going through divorce, custody, support, landlord, tenant, like any kind of civil legal matter.
Right.
We can help them with. And then obviously community education, outreach, we do work in the schools. Cocalico has been very for us, out to Sue. But yeah, so, and I'm proud of that because I graduated from Cocalico, and I'm really, it makes me proud to know that they are really working to provide that information to their students.
That's wonderful.
So, so we provide all of that, the school-based education, the community education. I'll come out and talk to any group. You put me in front of somebody, I'll sit with you, I'll stand in front of you, whatever you want. I'll come and talk to you about anything related to domestic violence. Yep. You just got to shout out to us and invite us in.
Well, I have to say, this is going to be a wonderful series. I'm quite sure we're going to get a lot of people who are going to be very interested to know all the things that are going on. Angela, thank you very much. This has been truly wonderful. And we'll see you again next week.
I'm looking forward to it. Thanks,
Great.
Kelly.
Absolutely. See you, everybody.